Welcome to Webinar 3, which is the last in this three-part series on self-care strategies for healthcare workers. If you missed any of the webinars, please go to the RGP YouTube channel, and to download the slides, go to the RGP website for the direct links in each resource section. I'd like to take this opportunity to introduce myself and the other panelists today. My name is Thérèse Lawlor. My background is social work and long-term care administration, with over 30 years experience working in geriatrics in both clinical and management positions. I've worked in the areas of long-term care, developmental disabilities, adult day programs, acute care, primary care, complex continuing care, community care, and psychogeriatrics. Currently, I am a psychogeriatric resource consultant with the Scarborough Health Network and the Regional Geriatric Program of Toronto. Charlene Marshall is a clinical social worker with many years of clinical experience in the fields of geriatric mental health, addictions, and forensics. She is currently a psychogeriatric resource consultant with the Centre for Addiction and Mental Health and the Regional Geriatric Program of Toronto. She also teaches at Humber College as a part-time instructor. Tony Schembri is a PRC with the Regional Geriatric Program of Toronto and the Scarborough Health Network in the Central East Lynn. Tony combines 25 years of experience in mental illness, acquired brain injury, and has 2 graduate degrees in education and psychology. Now that you've heard a bit about us, we'd like to know a little bit about you as to who's on the webinar today with us. We have 3 poll questions that we'd like you to answer. What is your role? Please click on the one that applies. Okay, it looks like we've got a variance here. Poll question 2, please. How many years of experience do you have working in the field? Most of the participants have 0 to 5 years experience, which is 100%. Okay. And the third, have you attended a previous webinars either in this series or in another RGP series? Please click on the one that applies. %100 have said yes. Wonderful. Well, for those of you who are just joining us today, welcome. And for those of you who have been here before, welcome back. Next. So this webinar acknowledges the impact of COVID-19 is having definitely on frontline healthcare workers. We're asking you to give yourself permission to take care of your mental health and make yourself a priority. Please note this webinar is not intended to be a substitute for professional medical advice. We're using a knowledge to practice framework which provides relevant content and resources. Please keep in mind there are many helpful clinical services made available for frontline workers to assist with the mental health impact of COVID-19. So our goals are for a self-awareness check-in, looking at the physical and emotional impact of working in COVID-19, looking at the changes of mental health phases over time, and navigating the available resources. Understand that COVID-19 has put all of us under stress and increased pressure in all of our lives. For the first time in our lifetime, we are dealing with a pandemic. The question we get asked most is, will we receive the slide deck? And yes, you will. The slide deck will be shared with you shortly following the training. This webinar will be recorded and posted on the RGP Toronto YouTube channel. And please type your questions related to the content into the chat. There will be opportunities for question and answers at the end of the webinar. So some of you who have attended will remember that we spoke about the roller coaster. So the roller coaster going forward, we usually can see the twists and the bends and the turns that are actually there. However, a roller coaster going backwards could probably be identified as being the corona coaster because you really don't know where the twists and the turns are. You don't know if you're going upside down or if you're going backwards or what might, well, you will be going backwards, but which way you're actually going. And this is very much like the coronavirus. We don't know where we're actually heading. One thing that we need to, the Organization, World Health Organization has a reminder out to all healthcare staff. And that is this, and this is the message. Feeling under pressure is a likely experience for you and many of your colleagues. It's quite normal to be feeling this way in the current situation. Stress and the feelings associated with it are by no means a reflection that you cannot do your job or that you are weak. Managing your mental health and psychological well-being is as important as managing your physical health. Before proceeding on, we're going to get Tony to take us through an breathing exercise. Tony?
Thanks, Thérèse. I'd like to introduce you to what they call square breathing, and it's to help us get centered. So we're going to do this 4 times. I'd like you to, it's a breathing technique, and this technique will help calm you when you feel anxious, or if you're feeling things are becoming overwhelming, okay? So let's start off. We're going to do this 4 times, okay? So breathe in, 1, 2, 3, 4. Hold, 1, 2, 3, 4. Breathe out, 1, 2, 3, 4, and hold, 1, 2, 3, 4. Okay, one more time. Breathe in, 1, 2, 3, 4. Hold, 1, 2, 3, 4. Breathe out, 1, 2, 3, 4. Hold, 1, 2, 3, 4. 2 more times, and just follow the square in the square breathing. Breathe in, 1, 2, 3, 4. Hold, 1, 2, 3, 4. Breathe out, 1, 2, 3, 4. And hold, 1, 2, 3, 4. The last time, breathe in, 1, 2, 3, 4. Hold, 1, 2, 3, 4. Breathe out, 1, 2, 3, 4. And then hold, 1, 2, 3, 4. And that was square breathing. And I find that if you're feeling anxious, it really helps to calm you and gets you a little bit more centered. Next. In webinar 1, we discussed the early stages of fear and anxiety and distress. What strategies to employ when you're feeling fearful and anxious. Rest assured, there are things to do so fear and anxiety do not worsen over time. Next. In webinar 2, we discussed mid-late stages. The mid-late stages included grief, burnout, fatigue, and substance use. We discussed what could possibly happen if your fear and anxiety grows unchecked. Next. In this third webinar, we examined further PTSD and described depressive symptoms to be aware of. We continue to encourage people to understand there is still things we can do to mediate possible outcomes, and you have to understand extra help can be found throughout all of the 3 stages. Next, please. Let's start off with post-traumatic stress disorder. Post-traumatic stress occurs with a mix of complex life experiences, including the amount of witnessed and experienced trauma since childhood. There is an interplay between the way your brain regulates chemicals and hormones, which the body releases in response to stressful situations. Remember, there's also an inherited genetic component to mental health with a chemical and hormonal interplay which simultaneously occurs while also adding more risk for PTSD. Ultimately, inherited genetic aspects of personality or temperament, along with life experiences, becomes included in the chemical hormone interplay. Eventually, as this becomes repeated, it can appear as PTSD. Next. Risk factors for developing post-traumatic stress disorder include or have experienced intense or long-lasting trauma, have perceived or experienced horror, helplessness, or extreme fear, watch other people get killed or become endangered, experience trauma in life, including childhood abuse or neglect, have other medical problems, and lack a good support system or family or friend. Some signs and symptoms include intrusive memories, hyperarousal, persistent avoidance, negative cognition and mood. What PTSD might look like at work includes trouble remembering or concentrating on tasks, feelings of fear and anxiety about completing usual duties, unreasonable reactions to normal situations, anger outbursts, and interpersonal conflict, avoidance of certain job duties previously comfortable with, and increased alcohol use after work. Performance deterioration is part of this, and lateness or absenteeism is included as well. Next, moral injury. With moral injury, some early research suggests that healthcare staff may have symptoms comparable to what soldiers experience during the theater of war. Moral injury is defined as the profound psychological distress which results from actions or the lack of them which violate one's internal or moral ethical codes. Remember these thou shalt not murder or do no harm come to mind. Morally injurious events can include acts of perpetuation, acts of omission, or experiences of betrayal from leaders or trusted others. Some early research suggests that healthcare staff show symptoms comparable to what soldiers experience in active combat. Unlike post-traumatic stress disorder, PTSD, moral injury is not currently a mental illness. My next colleague, Charlene, is going to talk to you about substance dependence and addictions.
Thank you, Tony. So good afternoon, everyone. Welcome back for those of you that have attended previous webinars, and a big welcome to those of you that are just joining us today. Before I get into talking about substance dependence and addiction, I just want to draw your attention to the context, the COVID-19 context, because this issue is very prominent. So back in March 30th to April the 2nd, Nanos did a national survey across Canada. They did a hybrid telephone and online random survey of 1,036 Canadians that were 18 years of age or older, and it was randomized. And they asked them about their substance dependence, their substance use during the beginning of the pandemic. And the results are quite staggering. 56% of the respondents reported that they were experiencing increased stress, which led them to an increased use in cannabis. 44% of the respondents also reported that they were feeling increased stress and their alcohol consumption has increased. So I would just like to keep in mind that this study was done back in March, and today we're talking in August about substance dependence. And Dr. Teresa Tam has actually been reporting this week about addiction, substance dependence and addiction being a national crisis during the COVID-19 pandemic. And just this morning, Global News reported with Dr. Bonnie Henry that the the increase in overdoses, actually, opiate overdoses have increased from a year ago to date this month, 136%. So both Dr. Bonnie Henry and Dr. Theresa Tam are calling on all levels of government to acknowledge the substance dependence crisis that we are facing during the COVID-19 pandemic. I also want to refresh our memory around what was deemed an essential service and why. So back at the beginning of March, when the Premier of Ontario was looking at what stores and services would be deemed essential, the Liquor Control Board of Ontario and the cannabis outlets were deemed essential. And a lot of people really didn't understand why those stores would be deemed essential. Well, it's because of the prevalence of substance dependence, and they actually consulted with the Canadian Centre on Substance Use and Addiction and the Centre of Addiction and Mental Health. So the prevalence of substance dependence in Canada is a real issue, and it's been exacerbated by the COVID-19 crisis. And we'll put up in the chat box shortly that actual article that just came out 2 hours ago with Dr. Bonnie Henry talking about the crisis. So when I talk about substance use here, I want to talk about the two major components, because substance dependence involves two things. It involves a psychological dependence, and in this webinar, we've been speaking about difficult emotions related to working in the COVID-19 crisis as a frontline healthcare worker. We've also been talking about possibly underlying feelings of depression, anxiety, and Tony just spoke about moral injury and post-traumatic stress. So psychological dependence occurs when a person feels that they need the substance to function or feel comfortable. So the best way I like to look at that is as a coping strategy. Physical dependence occurs when your physical body adapts to the presence of the substance. So your body gets used to it. So an example that I would like to share, in my role as a consultant, some of the staff that I work with reported to me back in March that they were struggling with sleep after their shift. And so they would have a glass of wine and maybe a bit of cannabis to help them unwind from the pressure of the day. And that was back in March. And over time, here we are in August, what may happen for people is that they will need more wine and or cannabis to get the same desired effect to help them sleep. And I just want to draw your attention to the Canadian Safe Drinking and Cannabis Guidelines. It's included in our references because I actually was showing this to my daughter and it was quite surprising. So what are the limits? Like, how do we know when we're drinking too much or using too much cannabis? So our Canadian National Guidelines recommend that for women, we only have 10 drinks per week with no more than 2 drinks a day. So what's a drink? Well, a drink actually is, for wine, 5 ounces, so less than a cup. Distilled alcohol, 1.5 ounces. Beer, 12 ounces. And cider or cooler, 12 ounces. So looking at the SAFE guidelines, 2 drinks a day most days, that's the maximum. And for men, they're suggesting 15 drinks a week with no more than 3 drinks per day, which are the same guidelines. With respect to cannabis, cannabis is legal, and there are some guidelines, and all of these guidelines, both the alcohol as well as the cannabis guidelines, came about through a whole bunch of input from the Canadian Nurses Association, the Canadian Medical Association, the Centre of Addiction and Mental Health, and the Canadian Centre on Substance Use and Addiction, Canadian Mental Health Association, as well as the Mental Health Commission. And when they're speaking about cannabis and our health, they're suggesting that cannabis is a personal choice, but it can have short and long-term effects on your health. Cannabis can affect your thinking, physical coordination and control, and increase your risk of accidents or injuries, reproductive issues, and it can exacerbate mental health conditions, including dependence. So smoking cannabis can also increase your chances of lung problems. So I just wanted to draw our attention to some of the studies that have been done and some of the standards around substance dependence, because it's a growing concern and several leading authorities are speaking about it. Next. So why do we use it? Well, this is a picture of our brain, and it's taken from the Harvard Health Letter. Why do we use it? We use it because it makes us feel better. So I've worked for many years as a frontline clinician in addiction medicine, and when I would ask clients, why do you use substances? The honest answer was, because it makes me feel better. So again, there is some neuroscience, though, and this is what this slide is speaking about, that we know that addictive substances do stimulate a reward circuit in our brain. That's why we do it. It feels good. And this reward experience then produces some wonderful brain chemicals called dopamine, and it encourages the brain to do it again and again. And it also creates a memory, creating lasting memories, linking the substance to a very pleasurable reward circuit. And this is why addictions and substance dependence makes recovery very difficult. And it's difficult to stop that cycle of the reward. Next. So the grip of addiction is real, and I know that for many individuals, personally and professionally, there's a lot of stigma. There's a lot of stigma and shame related to having an addiction, and this often prevents people from speaking about it as well as reaching out for help. And the simplest way, to determine whether or not a person has an addiction or substance misuse, there's the Diagnostical Statistical Manual has criteria, but really it's looking at, does this have a negative impact on a person's life or the people around them? Because the person that may be using the substance, the people that live with that person are also very much impacted by that person's behavior. And the simplest way to look at it is, does the substance create a negative impact far beyond what we see? And eventually it does begin to affect a person's physical health. So there are many comorbidities associated with addictions. Our emotional health. So as Tony was saying earlier about feeling anxious, feeling fear, depression, adding substances to those underlying emotions will only increase the negative impact. It also, addiction affects our thinking, our ability to think clearly and to use common sense sometimes and judgment, impulse control, things like that. People often engage in high-risk behaviors. It also impacts our ability to socialize and have healthy family relationships. And of course, with a progressive addiction, it may go on to impact a person's employment, housing, and their finances. So there are many ramifications and societal challenges to addiction, the grip of addiction. So if any of you know anyone or are aware of anyone that is struggling, it's really important that we let the person know that there is help and that this is something that can be treated, and there's a lot of support, and to not feel ashamed of it. Next. So addiction is complicated, and the complexity of addiction the slide speaks to it. So each person will have a unique experience. This is the best practice model, the biopsychosocial model of addictions. And really, again, when we're looking at the why do people use substances? There are many reasons, and sometimes there are multiple reasons. And it's important to recognize that if we're trying to support someone or help someone understand why they use their substances, we need to look at the emotional makeup of the person and what they're experiencing. Many people may have also experienced trauma and loss. I'm familiar with a caregiver who lost a child, and now during the COVID-19 crisis is experiencing a lot of flashbacks and very traumatic memories brought on by more grief. Biological, we're all different. We metabolize. There's some gender differences. Genetics, again, some people tend to have more of a predisposition. Environment, depending on the people that we socialize with, where we live. Physical, again, do we have, if you think about pain, many people take opiates to manage pain conditions. Psychological, again, each one of us, we're going to speak more in this webinar about resiliency, but we all have different protective factors in our personality and our psychological makeup. And what about the level of support? I remember people sharing with me that they would feel sometimes that their addictive substance was their best friend. And if they had to give up their substance, then who would be their best friend? So we need to look at the complexity of the addiction and recognize that it's not simple to just say to somebody, just don't do it, or we need to pay attention. And this is what addiction medicine would address if a person reaches out for help. Next, this again elaborates on that a little more, that again, the addiction medicine would look at, again, the stigma, but also the genetics, the bioneurological, psychological, social, and cultural. And if we want to put this in the context of COVID-19, this NANOS poll was done back in March, April. It would be interesting to see, what's changed. We certainly know that in certain provinces, as Bonnie Henry's province, there's been 176% increase in very serious opiate loss of life. Next. So what are the signs? Well, it's going to be unique for each person, but there's a general cycle here that we can talk about. So I'm going to use my colleague as an example. So back in March, she may have been able to have 8 ounces of wine and a little bit of cannabis to help her sleep and help her forget about all of the grief and loss that she experienced during her shift. But over time, she's now requiring more of wine and cannabis to help her sleep because the pandemic is still happening, and she's experienced more grief and stress at work. And where this becomes dangerous is if you think about people who drive while intoxicated, or even with cannabis while intoxicated, you have an increased tolerance to a substance. The obsession piece speaks to if I have a substance misuse issue, I'm going to be thinking about getting my substance, using my substance, how good it's going to make me feel. And then if a person increases their intake, then they may, the loss of control. And this is the big one here, number 5, is why do people continue to use substances even though it's harmful? And number 6 speaks to partly there's a strong physical withdrawal symptoms, and many people, this is very painful and difficult. So to avoid feeling withdrawal, you repeat the cycle. And we know that it's well documented, as I said, even in Mississauga last week, there were 3 young people who lost their lives because they used more of a substance than they intended to. And people with substance misuse issues and addiction issues do spend a lot of time thinking about how I'm going to get it, when I'm going to get it, and when I'm going to use it. And this is the addictive cycle that people can fall into. So what do we do? Well, one of the things, we've looked at in these series of webinars and in today, that we're going to talk about what's an alternative. What you'll experience if you are feeling stressed or anxious. So for instance, feeling fearful or constant worry. And I know for myself that particularly at the beginning of the pandemic, overthinking everything. Also a sign of stress or anxiety might be getting angry, getting easily irritated, short-tempered, short fuse, having difficulty sleeping, tossing and turning, being physically very tired, but emotionally not able to have a peaceful sleep. Difficulty concentrating, so being preoccupied, maybe again going over things in our mind. Struggling with decisions, not being able to make simple and or complex decisions. And again, this is where we've looked at in the webinar today, the consumption of alcohol, cannabis, and there's many other substances as well. Today we just spoke about alcohol and cannabis using more than usual, so increasing our consumption to cope with these feelings of stress and anxiety. And this is the challenge, is how to find other ways to manage these emotions. However, if you do use substances, it's really important to pay attention. And I think that number one is really relevant, because if a certain situation contributes to substance use, then we need to pay attention to that. What is going on at that time that leads me down this path? That's really important to pay attention and identify. It's also important to look at your frequency and your context. And we did speak a little bit about the Canada's low-risk alcohol drinking guidelines, which is approximately 2 drinks a day for women, and for men 3 drinks a day, and no more than that. And then of course the cannabis lower risk cannabis use guidelines, that's a little more involved, but they're looking at it in terms of using in a safer way. Avoid stockpiling alcohol, cannabis, and other substances. And a colleague of mine, her son works at the LCBO, and I remember when the LCBO was deemed an essential service, they had very limited hours. And what was happening, there were long lineups, and people were going into the LCBO and they were stockpiling. And so the shelves they were running out of alcohol. So they quickly extended the hours and tried to put limits on how much people could buy in one time. And then the last one here is really important and a big takeaway. If you or someone you know has a problem, it's important to reach out and ask for help. And we've provided several resources, and many of these resources are direct services, and particularly for healthcare workers. They're free of charge, and healthcare workers have been deemed a priority. And there's also a lot of written material as well that will draw your attention to shortly. So what are some of the things we can do to help ourselves and to stay positive and to try and manage as best we can through this pandemic? Well, the first one is stay active and keep yourself busy with activities that you enjoy. And again, this is as unique as all of us are. Whatever brings you joy. For some people that could mean gardening. For other people that could mean cooking. I know during the pandemic, a lot of people have rediscovered baking. The second one here: stay connected with friends and family while still practicing physical distancing. And this is an area that I've struggled with, and I'm just now beginning to feel comfortable going out socializing with close friends and family with physical distancing, so I'm not isolated at home. Find balance. So this is, again, staying informed of the news, but know when to take a break. from the COVID-19 news and the topics. And I've shared with you today that there's been an increase in opioid addiction deaths. There's also been an increase in gun violence. So again, finding that balance of how much news do we absorb and how much do we maybe take pause, because there's a lot of suffering and tragedy and grief. We talked a lot about being kind to yourself, recognizing that yes, this is a difficult time and you're doing the best you can. You're doing your very best to manage a very challenging situation. And I know for myself that when I start my morning in the shower, I say this, and I really say this to myself, that I'm going to have a good day, I'm going to make the best of my day, and I'm going to do my very best. And I try to set an intention at the beginning of the day so that I welcome the day and I start with a really positive attitude. One of the things we can control is how we take care of our body by eating and sleeping well. And again, that's going to be unique for people, but keeping to a regular schedule and trying where possible to eat foods that give us good nutrition and make us feel better. Exercising and meditating, and again, this can be done in small pieces. I think I shared that when I took an online meditation course with the Center for Addiction and Mental Health, we would take a 10-minute walk, mindfulness walk, and I live in an apartment on a balcony, and I would do it on my balcony. So it doesn't need to be a lot of time, even 5-10 minutes. And again, it'll be as unique and as your interest and your tolerance. And lastly, but it's important to reach out for help. If you're struggling or there's something really bothering you, reach out. Contact a trusted family member or friend, somebody who's positive in your social support system. And if need be, seek professional support. And again, we've got some resources here at the bottom of this page, and we have another list that you could access as you see fit. So here are the addictions resources, and again, you're going to take what you need. And again, I like to think of it, if you had a problem with your, if you had a problem with your tooth, you had a toothache, you would go see a dentist. So these resources are here, and all of these links are working. And again, some of them provide written material, some of them are actually direct service links so that you can reach out and speak to somebody for a referral. So today we looked at the after post phase. We've been looking at the early, mid, late, and after. And today we've went into more detail with substance use as it relates to post-traumatic stress symptoms as well as depression. And we're going to now look at some things we can do to help ourselves in a positive way. So I'm going to hand it over to my colleague, Thérèse.
Thanks, Charlene. So one of the things that's actually really important is that we build resiliency. Some of you have actually started those steps of building resiliency, and some may be actually kind of figuring out how can we do that. Well, according to the Mayo Clinic, resiliency is the ability to adapt to difficult situations. So when stress, adversity, or trauma strikes, you may experience anger, grief, and pain, but you're able to keep functioning, both physically and psychologically. However, resilience isn't about putting up with something difficult, being stoic, or figuring it out on your own. In fact, being able to reach out to others for support is a key part of resiliency. Resilience can help protect you from various mental health conditions, such as depression and anxiety. So being resilient can improve your coping ability. And what we'd like to do is actually go through some of the building resiliency exercises that can kind of help you with that. So here in front of you is an infomatic, which you're actually taking a look at this picture which says, I cannot control, so I let these things go. So you're in the center, and we're looking outside for what you cannot control. You can't control others if they don't follow the rules of social distancing. You actually have no control over that. The actions of others, you can't control that either. or predicting what will happen, out of your control. Other people's motives, that's also out of your control. And the amount of, in the pandemic, the amount of toilet paper at the store is out of your control too. So how long will this last? You don't know. And then how others react is also out of your control. But there are things that you can control. So within the circle, you can see I can control, so I can focus on these things. My positive attitude. So as Charlene mentioned, she has an affirmation that she actually is going to be positive, and she says that to herself in the morning. You can also say that to yourself at night as well too, that you've done the best that you can, you've done the best that you possibly could manage that day, and it was a good day on the good things that turned out. So it's a positive attitude. Following the guidelines and the recommendations from a known source to give you the proper direction. You can definitely practice your own social distancing. So when you're in the grocery store and there's somebody who isn't practiced social distancing, you can actually move to the side or move backwards so that you create that social distancing. Turning off the news. This is a very important thing. We are actually bombarded with so many things on the news, with our CP24, with our our media, with all the different stations. You need to turn off that news, because that can be enough you can control that. Limiting your social media. There's lots of things on social media that also can inundate you and actually create anxiety, can create stress, and can create a lot of these situations. So what you want to do is you want to limit the amount of social media that you expose yourself to. And finding fun things to do at home. So you might find that, as was mentioned earlier, that you might decide that you want to do baking with your kids, or you might want to bake a special cake, or you might want to do some gardening, replanting outside, or you might go bicycle riding, or you might go walking. All of those kind of things are fun things to do at home, but they also build into that positivity and resiliency. And a really important thing is kindness and grace. So even though every one of us is actually going through this pandemic, some of us may be experiencing it a little bit harsher. So realizing that when you may have a colleague or somebody else that actually might be a little bit gruff in their response, that probably it isn't intentional. It's got something to do with the circumstances and all of those things that are happening. But again, how I react is in my control. So the really important takeaway message from this is the things that you cannot control, let go of them. The things that you can control, focus on those. Those are the things that will actually get you through, and those are the things that will actually help you to build resiliency. So I'm going to pass this over to Tony, who's going to take us on a bit of a guided pause, because this is another strategy that you can use to help you through. Tony?
Thanks, Thérèse. And keeping on the theme of resiliency, we are looking at mindfulness, and this is a little guided imagery, guided pause. And we encourage you to try this and build that resiliency and build your strength in doing this. So encourage to get into the practice of slowing things down for yourself and to evaluate your situation while relaxing at the same time. It takes about 1.5 minutes. Get about as relaxed as much as you can where you are, and please listen to this narration and practice doing this for yourself at some point. While focusing on the picture, listen to what is being said. So this is a short practice pause to help us stop and reconnect with the present moment. We're inviting you to ask a simple question, such as, how am I feeling right now? Perhaps, what am I experiencing in this moment? And noticing, without judging, what is here. Keeping this practice simple and getting into the habit of stopping and checking in with the present moment. After this pause, carry on with the next moments of your day. Perhaps practicing this several times a day to help you to stop and to interrupt any automatic thoughts and to reconnect with yourself presently. So we're going to move on from this onto the next slide. to recap. We've discussed what happens in the early stages as we encounter this pandemic. We included what to expect while working in healthcare during this pandemic. We encourage proactive ways to treat yourself and to be aware of the things you are saying to yourself and what your environment is warning you about. In the early stages, it is easier to address problems and much can be done to change the way to think about what is happening. In webinar 2, and in this webinar, we also talked about the possible outcomes if you do not reach out to seek help. What people in healthcare are experiencing during this pandemic is very real, and we all may need extra help to make some sense of all of this and our emotions and issues. We have never experienced a time like this. Our message to all healthcare workers is one of encouragement to understand and seek out the help you need. There is much help. If there is a clear message in all of the webinars, there is hope through all of this. You are resilient. Please take care of yourself and make use of any links that can help. In this one, we have actually the think technique that Charlene talked about and the ABC technique that Charlene also talked about. Please use these. I really enjoyed the WW Mac and anxiety. Next slide, please. And also for mindful pauses and mindful compassion exercises, they can be found here on HTTPS, self-compassion, and I really like the pause for providers. Thank you, and we're gonna have Charlene, my next colleague.
Okay, thank you, Tony. So this quote here is taken from Brene Brown. Some of you may know of Brene Brown. She's a social worker and she's a professor, and she has written many books about human compassion and human vulnerability. And her message is really about, it resonates with this webinar and our role as healthcare workers, that there's strength in our vulnerability. And I think that that's a big takeaway, to recognize that being vulnerable and part of this human experience takes courage. And it takes courage to get up every day and stand in your truth and face all the things we have to face. So this is a quote I'd like us to think about, and I actually have this on my fridge, and this is going to be one of the big takeaways of our webinar series. When I see people stand fully in their truth, or when I see someone fall down, get back up and say, damn, that really hurt. But this is important to me, and I'm going in again. My gut reaction is, what a badass. And again, I think the big message there is, I know for myself personally, I've experienced many things during the pandemic and other times where I fell down figuratively. And it's about having the courage to get back up, regroup, and say, I'm going to try again. I'm going to do my best to move forward and make a difference. And I think it's a very powerful quote. So I encourage you. She has some wonderful podcasts, TED Talks, and of course books. And I know that the libraries are open now, and I have, she's written several books that you can borrow as well from the library. This is our final inspirational message for today, and it's a YouTube clip called A Glass of Water. So I'm now going to hand it back to Thérèse.
Yes, that's certainly a very powerful, inspirational message for sure. So we've actually wanted to know, was this helpful for you? And are there any other topics that you'd like to see? So if you have any questions, you can type them into the chat box. We'd be happy to answer some questions. We have a little bit of time before the end of the webinar. Charlene, I believe we had a few questions beforehand that were sent to us.
Yep. So one of the questions was, as a result of these webinars, what are some of the things that you're going to do differently? And one of the participants talked about journaling versus watching TV, and drinking more water instead of alcohol.
Excellent.
Yeah.
I know we also had a participant tell us that they were going to do gardening, because doing that gardening actually gives a chance to kind of feel the earth and feel the connection with the earth, and actually was quite a stress release for this individual that had mentioned it in one of our webinars. And some are actually doing jogging or walking and all of those kind of things to kind of release. Yeah.
Yeah.
Just to come back to your talk about gardening, what a metaphor, smelling the roses and taking time to smell them.
Yeah, absolutely.
Yeah.
Absolutely. Yeah.
And another question was, why are we so hard on ourselves?
That's
Why are we our worst own critic?
It's a huge question. I think a lot of the times too, when we're that hard on ourselves, we need to ask the question and kind of, and this is where you actually reverse that question and you think to yourself, if that was a friend of mine, would I be that hard on them?
Right.
And if the answer to that is no, then maybe you need to be a little bit kinder to yourself.
Hazel put down an interesting conversation. How do you start one with your colleague who may need assistance?
Yeah, with substance. I used to deal with COVID stress.
Yeah.
Well, I think that the first step is always to open the conversation, because again, Hazel, there's a lot of stigma related to substance use, and an open, building a therapeutic alliance to say something like, how are you doing? How are you managing? And have the non-judgmental piece is really critical, because a person is already feeling upset about the substance use. There's a lot of internalized shame. And so they want to make sure that if they share with you that you're not going to judge them or label them or anything like that, and try to build that therapeutic alliance where they trust you enough to tell you what they're really experiencing, because people often underreport. They may go see their family doctor, but they're not going to talk about their substance use. So that's one suggestion. So yeah.
And in that trusting relationship, you could make suggestions if they so desire. But you're right, it does take a trust, doesn't it?
Yeah.
I'm wondering, Charlene, if one of the things, again, if you've developed that rapport and trust, is to let them know some of the changes that you see within them and ask them the question, is there something that I can help you with? Or do you think that maybe you need it would help? Would that be something?
Absolutely. Yeah, there's something called motivational interviewing, which speaks to that exactly, because sometimes, Hazel and everyone, people are not aware of the negative impact of the substance. So sometimes talking about just sort of the impact can be helpful. I know in preparing this webinar, I showed my daughter the cannabis standards, and I know with young people, many of them said to me, well, it's legal, it's, and so I just showed it to her without being judgmental, right? This is just information that this is actually what cannabis does do. Did you know that? And left it at that.
Yeah, absolutely. Well, I see we're almost out of time, so maybe we can just bring the last slide up.
Thank you, Hazel.
Thanks,
Yeah.
Hazel. Yeah. So again, just to remind everyone that the webinars, webinar 1, 2, and 3, are all on the RGP YouTube channel, and the slides are on the RGP website. Really important to note that you need to download the slides, and then what you can do is once you save them, all of the links that you see in both webinar 1, 2, and 3 actually all connect to the resources that we've actually pulled out, so that you can actually look at a section and say, I need to know more about that, or can it guide me a bit more? And you can click on that link. But please do remember that you need to download them to your computer or to your, and go from there. This is actually the end of our 3-part series. So all 3 series, as I say, are posted on YouTube. There will be an evaluation that will come to your inbox as well too. And we ask you to please fill out that survey monkey and give us some suggestions or recommendations as to what you would like to see more of. That would be very helpful.
Mm-hmm.
Again, on behalf of myself, Charlene, and Tony, we would like to say thank you for all the work that you do.
Yeah.
It is invaluable. And we certainly wish you to take care. We also ask that you please concentrate on your own self-care, because you need it. You give so much to healthcare, you give so much to those patients, residents, clients that you deal with. You need to take some time to actually focus on you. So we hope that this will actually engage you to actually do that and to seek out more information. Is there anything else, Tony or Charlene, you'd like to add before we say goodbye to everybody?
I can't think of a thing right now.
I would just like to echo that you are your most valuable resource. So it's an investment in yourself so that you can help others.
Yeah,
Absolutely.
so continue. Yes.
Absolutely. So on behalf of all of us, thank you, thank you, thank you. Take care and goodbye.
Bye-bye.
Goodbye. Bye, everybody.